Welcome back to WBRZ News 2 at 4. Dr. Stevens is back with us. Welcome, Dr. Stevens.
Glad to be here.
Yeah, so we're talking about dog bites today.
Dog bites, yeah, big problem. You know, and Brittany, we see this especially in the summertime. Probably one of the most common injuries we're called to the emergency room for are dog bite injuries to children. And I don't know if you realize, but you know, almost half of kids by the time that they're 12 will have experienced a dog bite. So it's a huge issue, especially that we see as plastic surgeons trying to reconstruct these problems. Anywhere from small scratches to problems that we have difficulty reconstructing. And they're usually on the face. And because, and it's usually the household dog. I mean, it's the common thing.
The dog, yeah, the dogs that's around all the time.
Right, exactly. And because we have small kids, we have some pictures here that are slightly graphic. But most of the time, the kids are playing with the dogs, and dogs defend themselves, and they play with other dogs by dominating. And usually they'll bite in the face of other dogs. And the same thing with small children, is that they're at their level. And so,
that's right.
Exactly. And so a lot of these injuries are to the face, most of them the neck or the face. And they can range from anything from a scratch to major injuries, which can leave a problem for a lifetime for some of these kids.
So how do you take care of this?
Well, I think education is the #1 thing. We need to warn people to educate their dogs, train them, and socialize the animals, and be ever so vigilant when children are around with the dog. Don't let them play, especially get in their faces with these animals. I'm always scared when I see even my dog, who I know potentially won't bite, but you got to realize every dog has the potential to bite. They all have teeth, and they defend themselves, and that's the way that they play. And so the best thing to do is keep kids away from dogs, especially in their face, and train the dog. It's not the dog's fault, it's the owner's fault.
Yeah, and I will never forget, I've been bitten a couple times.
Yeah, I mean, I think we all had experiences.
It's scary, and you never forget it, and I can only
don't.
imagine what it's like for a little child.
For a little child, and you know, some of these problems we cannot fix, and they are lifelong injuries. And so I can't tell you how many times we're called to the emergency room with the same old mantra, you know, my dog, my household pet has bitten my little girl, and my dog never bites. Well, the truth of the matter is every dog has the potential to cause an injury to a child, and I think that's the message that we need to get across to most people.
What about scarring after the fact?
Well, scarring after the fact, once you have a scar, there are a few things that we can do to minimize that, depending on if it's a physical problem like it pulls the eyelid down, for example. That's something that we'll have to revise. But most scars are there for a lifetime. That's the way that we heal. There are a few things that we can do, but for the most part, once you have a dog bite, because it's a crush injury rather than a clean cut with a scalpel, those type injuries will stay there for a lifetime.
Wow. Wow.
Yeah, it can be a serious problem, as opposed to other bites. I mean, we see cat bites all the time, which are usually puncture wounds. Dog bites are usually crushing injuries and more of a tearing of the tissues, and so they will leave more injuries to bone, you know, cartilage that we have in the nose and that sort of thing. And so we see a lot of this, especially during the summer months when the kids are out of school.
All right, Dr. Stevens, thanks so much for coming in
Sure.
and talking to us today. You're watching WBRZ News 2 at 4. We'll be right back.